Hi, I'm Jesse Brown with Detroit Holistic Center and Holistic Training Institute, and I'm speaking here today with Dr. Nakadar, and he specializes in treating conditions with medical cannabis. Now, it's controversial. There's more and more information that's going on about it. It's legal in Michigan and many different states, but we're going to talk to him a little bit about his background as a medical doctor and what conditions can be effectively treated with medical marijuana. Thank you for coming, Dr. Nakadar.
Thanks for having me. I'm excited to be working with you, and it's going to be. I think we'll get some great things done here.
Oh yeah. I mean, there are a lot of people. Yeah, this is a big problem.
Big problem. Actually, the healthcare system in general is in some trouble just because of a lot of the way medicine's actually practiced. There's a lot of push from patients to find other alternatives other than pharmaceutical agents, and they are starting to unlock a lot of the different ways that they can heal themselves with different modalities. And I think medical cannabis is one of those modalities. It's really important as a part of someone's medical regimen that this can provide a lot of different symptom control and different relief for which they may be taking multiple medicines and actually causing themselves more harm than good. I tell most people that you don't look at medical cannabis as smoking a joint or hitting a bong anymore. It's really not about that. It's really about finding a practical way to apply this medicine. And that's where most people need a little guidance. A lot of people who use it already and self-medicate have a pretty good understanding, but there's a large number of people out there that are suffering from multiple medical problems, and those medical problems seem to always have a constellation of symptoms that are in common. So things like pain, nausea, muscle spasms, different issues that
even
kind of
anxiety.
Anxiety.
And who doesn't get anxiety and restlessness?
And that just kind of comes along with having a chronic problem. Your body's just telling you something's wrong, right? Anxiety is like our primitive alarm system, let's say. And sometimes things trigger that abnormally, right? Or things that we can't control are triggering our anxiety. So, if you're chronically ill and you're fatigued and you're not able to sleep and all these things are out of balance, then the anxiety kicks in because your body's trying to tell you, hey, you got to fix something here. And, that's a lot of times where cannabis really kind of comes in because it fixes a lot of different symptoms at one time. And you're not, you can control your nausea, you can control your pain, it can help you sleep, it can help you with anxiety, it can help you with appetite. And these are all different things that most people kind of need, or it ruins their quality of life when they're dealing with a chronic medical condition. So if we can get people to eat better, sleep better, and have less pain, we've made a big impact on their quality of life. And a lot of times they're chasing medications with different medications, right? So,
and that's where they get into opioids and the prescription medications that are causing all the problems that we're hearing about today.
They're talking about. That's a great example. So we have a big opioid crisis. We're prescribing a lot of medications. If you've seen on TV now, they have ads for medications to deal with the constipation that's caused from opioids, which don't always have to be prescribed, right? So,
and we're seeing a lot of that over the past 30 years. We've seen tens of thousands of people who have constipation because they're taking pain medication.
It's a big issue, and a lot of times it's a barrier for them to take their pain medication. So if we can adjunct that with other treatment modalities, and there's still always going to be a place for those opiates or narcotic medications. We're still going to need them as physicians and as a healthcare system. We have to be able to provide that type of analgesic as well when it's necessary. But I think we've just overly used it for every situation versus the ones it really needs to be used for. Well, the big thing, 10 years ago, 15 years ago in the hospital was, oh, did you treat my pain? And then so from the business side of things, the big thing was our patient satisfaction score. So the surveys that people filled out had a lot of questions about pain, and so that was a big factor as well into why so much pain medication was given, because there was a big push to make sure people weren't in pain and that they were satisfied in the hospital. And that's not the only reason. There's a lot of different factors that kind of play into this. But all these things combined have put us into a situation where people are very dependent on these medications. Now even Medicare is talking about putting restrictions on how many opioid prescriptions physicians can even prescribe or that the pharmacy can even fill, which I think is maybe a little bit overreach or overstepping kind of the bounds. But they're looking for ways to fix the problem, and not every solution is going to be perfect. But unfortunately, we all have to deal with it, and cannabis has really helped a lot in making sure that we have a good option and an alternative to helping with this crisis as well.
Okay, so that may very well be the answer. So we're looking at medical marijuana or cannabis as an alternative to a lot of the health problems that are occurring. For more information, we want you to contact us at Detroit Holistic Center. We have more information on our website, DetroitHolisticCenter.com. You can call 313-538-5433. That's 313-538-5433. If you would to speak to Dr. Nakadar, if you'd like to schedule an appointment, that's possible as well. So until we see you, until next time, and we're going to address some more of these topics as well with Dr. Nakadar.
I look forward to that, yeah.
And so be well and give us a call, and hopefully you have a healthier, more holistic life. See you soon.